Connolly, please.
The Cancórla agus híisi banama ceis le galia agus an fáinne fi atá siúl faríor géir le fad an lá ó híh an rain nua timpiste agus éigeandála agus an tospidil nua atá bartia. Tá sagam go bhfuil neartólas agad faoi galia agus is ar a sláintethú agus bhí tú in galia cúpla úr agus de leir tú faoin topic, faoin ábhar seo. Tánaiste, my question relates to the hospitals in Galway. And I know you're very familiar with it, and you're an ex-Minister for Health, and you were down there yourself. And I use the word fáinne fi in Irish to describe the unreal magic that's going on in relation to the accident and emergency and the lack of progress in Galway that you're very familiar with. Your Taoiseach called it, your former Taoiseach, Enda Kenny, not fit for purpose. The current Taoiseach echoed that. Simon Harris said the exact same thing. I looked at the questions. Honestly, you would need an advanced postdoctorate degree in some type of English, I'm not sure, to understand the responses. We talk about business cases being updated, feasibility studies being updated. I understand that the estates part of the health executive is looking at it at the moment. I don't know what they're looking at. But what I do know this. There is an urgent need for an accident and emergency department in Galway. And you've all agreed with that, but it's nowhere to be seen. No plan and application, no nothing. Separately, we had an options appraisal that came down on the sides of a new hospital in Galway as the long-term plan, in addition to short-term and medium-term solutions. And we've had a capacity review of beds. Galway Hospital, as you know, caters for approximately 1 million people from Donegal down to Galway, one of the busiest in the countries. I'll just, in my few seconds, read out what this was: an additional report to the options appraisal, the Regional Elective Hospital Scoping Study. A study carried out on the existing infrastructure showed 64% and 95% of the infrastructure in the regional hospital and Merlin Park, respectively, is not satisfactory, unacceptable for its current function. Later on, it talks about operating at capacity and lengthy waiting lists and so on. So I'll try to be focused. I have a sense of utter frustration. I can't imagine what it's like for the staff, but more importantly, the patients on the ground. So I have responses here telling me back in 2015 that it was going on the capital list, the emergency department. I have an options appraisal and I have a scoping study telling me that the long-term solution, and the long-term being in the next 10 years, for a hospital in Merlin Park. And in between then, we have the programme for government promising an elective hospital, which I have no difficulty with. My difficulty is with the confusion. And two of your colleagues having a public spat in Galway in relation to who's holding back what. Now, that's not the type of leadership we want, and that's why the health executive got an options appraisal to guide the way forward. If you could, please give me a focused reply in relation to what you know about Galway.
Tánaiste.
Thanks, Deputy, for raising this question. And I've been asking this question myself in the last couple of weeks because the commitment was made by government many years ago to build a new emergency department in University Hospital Galway on the existing site. That's in the Project Ireland 2040 plan. It's in all our capital plans for quite some time. And my understanding, and I may not be fully up to date on this, but my understanding is that the plan is to build a new emergency department and also a new maternity and paediatric department in the same building on the University Hospital Galway site, and that has been the plan for quite some time. I made inquiries myself a few weeks ago to try to understand why it is all taking so long. And like you, I received a lengthy response, but not one that I was able to fully interpret or understand. And I'm not happy with that either. And I am going to follow up on it with HSE, because, as you say, University Hospital Galway is not just the hospital for Galway City, it's a specialist centre for the entire West and part of the Northwest, and therefore should have as good an emergency department as exists anywhere else in the country, whether it's the new one in Limerick or new ones in Dublin hospitals too. So I will look into that further. In relation to Merlin Park and the elective hospital, no decision in government at least has yet been made on that. There is an active debate underway as to what the elective hospitals in Dublin, Galway and Cork should look like. Should they be day hospitals only, or should they have overnight facilities as well? And while there have been options appraisals done on that, no decision as yet has been put to government.
Tánaiste, if you have difficulties understanding the replies, and I have, that tells you something, doesn't it? So really, it's time for leadership. In relation to an elective hospital, that came from an options appraisal. That was never exclusive to the plan for a new hospital on Merlin site. That was to be step one in that phase. If it's a thing that the accident and emergency is better suited in the new hospital in Merlin Park, so be it. But let's stop having the fáinne fee arai agus arai gan ein shiel thok dini a kalunch winning as an chorus. We're simply losing all confidence in the system. If the accident and emergency, it went up 4 or 5 floors in their imagination, in the planning imagination, it came back down to 2 floors. It went to incorporate the maternity unit overhead, which is a good idea. But it seems that the time span for that is almost nearly the same as the time span for a new hospital in Merlin Park Hospital, if we go by the options appraisal that was presented to us in the AV room. So I really, and then to have a spat between 2 of your colleagues and one accusing the other of delaying it is simply unacceptable. We want a new hospital for Galway, we want a timeline, we want clarification in relation to the emergency department, and we want no more of this obfuscation.
Tánaiste, to conclude, please.
Thanks, Deputy. I think we're agreed on one point. We need a clear plan for hospital services in Galway, and then we need to get on with it. I'm frustrated and embarrassed as well that this has taken so long, because this was a project that was live when I was Minister for Health, and that was a long time ago now. That's 5-6 years ago at this stage. I will take this up with the CEO of the HSE. I appreciate the HSE has a lot on its plate at the moment, particularly the pandemic, but that shouldn't be a reason for this project not to progress to design and planning permission. And I want to thank the Deputy for raising it here. Notwithstanding their differences on some points, I can assure you that both Deputy Naughton and Senator Kine are equally keen to see the new emergency department built and health services approved in the region. And like I say, I will take this up with the CEO of the HSE in the next couple of days and try to get things moving again.
Thank you very much, Tánaiste. That